In this video, we are going to talk about the infectious skin condition known as scabies. Scabies is a contagious skin condition caused by a type of mite known as Sarcoptes scabii. These mites are about 8 millimeters long and cannot survive outside of the human body for more than a few days. They bury into human skin in order to survive and lay eggs. They are passed between people through direct contact, like touching an infected person, or by touching something that an infected person has touched.
Where is scabies common, and who is more likely to get it? Scabies is a worldwide problem. Globally, more than 200 million people at any time have scabies, and any age group, race, and socioeconomic group can be infected by the scabies mites. However, there are factors which make scabies spread quicker, such as number 1, which is overcrowding. This is seen in old age homes, prisons, orphanages, and schools. Number 2, delayed treatment, which occurs when people take a long time to go to their nearest clinic once they have scabies. And lastly, lack of awareness from the public about scabies. So, not knowing what scabies looks like, or what to do when one has it, or even how it's treated. How does scabies spread? Scabies can be spread directly by close personal contact with the person infected, or indirectly by using the clothes or linen of someone infected with scabies before disinfecting the items. Several members of a family can be infected at the same time due to the way that scabies is spread. A person is able to spread the infection until both the mites and the eggs have been destroyed by the treatments, which is why it is important to treat the infection as your healthcare provider has told you to.
Classic scabies. What does scabies look like? They look like small red papules or bumps that are itchy, worse at night, and can affect many parts of the body. Here is what scabies can look like on the sides and the webs of the fingers, the wrists, the sides and the back of the feet, and the trunk of the body. In children, there is heavy involvement of the palms and the soles and all aspects of the fingers. It is usually more red, and you find often there are small blisters. Crusted scabies begin with poorly defined red patches that quickly become scaly. They are often less or not itchy at all, and although any area of the skin may be affected, it is more predominantly in the scalp, hands, and feet. Nodular scabies is a less common manifestation of classic scabies. It is characterized by a firm, persistent, red, and extremely itchy dome-shaped papule or bump that is about 5 or 6 millimeters in diameter. The areas that are mostly affected include the groin, the genitalia, the buttocks, and the armpits.
So how is scabies treated? Scabies is treated through a collaboration between you and the doctor, where you work to eradicate the infestation, treat the itch that is commonly associated with scabies, treat the complications of scabies should it complicate, treat close contacts such as your neighbors and co-workers, as well as take environmental measures to minimize spread and recurrence of scabies. Classic scabies infestation is eradicated through the use of benzyl benzoate lotion, when all members of the household and close contacts are treated at the same time to prevent reinfection. How? Apply the benzyl benzoate lotion with fingers or a brush to the whole body from the face or neck downwards, especially including all the skin folds, and leave the lotion in place for 24 hours for adults and for 6 to 8 hours in children aged between 2 months to 2 years. This lotion is applied once daily on 2 consecutive days with a repeated treatment cycle after 1 week. Children younger than 2 months are given a sulfur ointment to use daily for 3 days. Wash all clothes and linen worn and used in the previous 24 hours in hot water. Hang these in the sun and iron them if it is possible. After the 24 hours or 6 to 8 hours in children, remember to take a bath and dress in clean clothing, changing the bed linen at the same time. Also, remember to reapply the lotion to the hands after hand washing. Crusted scabies is a type of scabies that usually occurs in people with a weakened immune system. It is treated with oral antibiotics and antiparasite cream that's applied overnight to the whole body. Remember to bath or shower in the morning to remove the antiparasite cream. To treat the itch that is caused by scabies, your doctor will give you oral medication called antihistamines for night and day use. If the itch doesn't respond to the antihistamines, they may give you a steroid cream. If the itch is still persistent even after the steroid cream, they may prescribe you steroid tablets for about 2 weeks. If the itch doesn't respond to any of the above measures, it is likely that you have gotten reinfected or another diagnosis needs to be considered. People with scabies may develop another infection at the same time, and they may develop nodules at the site where the initial lesions were. The infection is treated with oral antibiotics, and the nodules are treated with steroid ointment or steroid injection directly into the lesions. The environmental measures to minimize spread and occurrence of scabies include putting items that cannot be washed, for example cell phones, in sealed plastic bags and put away for at least a week to allow the mites to die. Carpets and upholstered furniture need to be vacuumed and the dust discarded. Scabies usually don't survive more than 2 to 3 days away from someone's skin. Insecticides and fumigants are not recommended, and it is not necessary to treat your pets. Now, when can you return to work and school? People who have been infected by uncomplicated scabies may return to work and school the day after the first treatment, as long as the treatment has been administered correctly and you commit to completing the prescribed course of treatment.